So what if your medical career didn't end with one closed door, but rather it's opened into nine, nine different options? It's wonderful, right? In 2025, Canada is offering international doctors a unique opportunity. And what do I mean by this? 9 different provinces. So count 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 different provinces. And each of them have their unique practice-ready assessment program. Ooh. For me, I like it because it opens so many doors. And the best part is that because each program is slightly different, it offers you, the candidate, many choices. So, and I'm talking about real choices. And because you have the abundance of choices, you also have the abundance of hope. So you may say, who am I? I am Dr. Brony. I'm the lead tutor at MedCognito. And over the period, we've gathered countless doctors into all the programs across Canada so far as the practice-ready assessment is concerned. And the reason why I'm saying this is because I went through the practice-ready assessment as well. So I've gone through the ropes. I understand all the steps you need to go through to get to where you are. And we are here to share the knowledge. And I'm also here to make the process less overwhelming and let you understand that it is very, very achievable. So today, I'm not here to compare or rank the provinces. No. I'm rather here to show you that no matter the background you're coming from, there is a province which is ready for you so far as you meet the eligibility criteria. And you'll be surprised that so many options are there for you to get into the Canadian healthcare system. Okay, so let's take a step back. You may be asking yourself, what is PRA? What is PRA? So the PRA stands for Practice Ready Assessment. And it is a bridge, interestingly, it's a bridge in Canada for internationally trained doctors, to come walk over that bridge and then get settled into Canadian practice. And this goes for people who have already had postgraduate training and have independent practice abroad. To bring your experience from wherever you trained and bring it to Canada, you go through an assessment process to make sure that you are at par with the Canadian healthcare trained physician, and then you can go to serve the people in that particular province. So here's how it works. Most practice-ready assessment programs will let you undergo a 12-week work-based clinical assessment in a Canadian healthcare setting. And it can be, in a rural area, it can be in an emergency room. Most of the time, it's a combination. Long-term care facility, a clinic, an outpost clinic, virtual care. So many things go into it. And you do this under supervision, and you are seeing actual real patients, but you're not left alone. So it's a guided process. And when a candidate succeeds, you get a provincial license in that particular province to practice. And there are steps you can take to then get a permanent license, which we can talk about in a different video. But you realize that these are all tied to a return of service commitment in a community that needs doctors most. So think about the practice-ready assessment as an opportunity for you, at the same time an opportunity for the community you're going to serve. And it's an opportunity to actually get to know the people in the community so you can serve them better. So the PRA isn't just a test. Rather, I see it as a doorway into Canada's healthcare system where your skills will have to meet the Canadian need. And here is what it gets exciting. You're not looking at just one option. You're not even looking at two. Look, you're not even looking at 5. You're looking at 9 different provinces. So let's look at the various provinces and let's go into them one by one. In 2025, these are the 9 provinces and the 9 programs which are across Canada. And I'm going to take my time to go through each of them. So in British Columbia, that's the first province I'll talk about. They have what they call the Practice Ready Assessment BC. Or if you are typing it in Google, just type in PRA-BC. In Alberta, they have what they call Practice Readiness Assessment Alberta. So PRAAB, okay? And then in Saskatchewan, we have the Saskatchewan International Physician Practice Assessment, which is popular among international medical graduates and known as SIPPA, SIPPA. And in Manitoba, we have the University of Manitoba International Medical Graduate Program, which is PRAMB. And they have both a stream for family medicine and a specialty practice pathway. And then in Ontario, we also have the Practice Ready Ontario, which is also known as PRO. And if you are very good with French. Quebec also has a unique practice ready assessment program. We call it the Collège de Médecins du Québec PRA. And that one requires French. Okay. So if you know French, think about Quebec. And we also look at New Brunswick. They have the practice ready assessment New Brunswick. So it's called PRA-NB. And then if you go to Nova Scotia, we have Nova Scotia Physician Assessment Center for Excellence. And a lot of candidates know it as PACE, P-A-C-E. And then you go to Newfoundland and Labrador, we have the Practice Ready Assessment NL or PRANL. So you realize that so far as the names are concerned, each of these programs is also unique. Not one is better than the other, not one is worse than the other, but they are all unique in their own right. And they are just different. And that difference is what Canada uses as a gift for you, because each of us as doctors are also different. We are trained in different countries. And because of that, Canada says, bring your difference. It is your difference which makes us a unique people in Canada, all right? So because of these differences, no matter your strengths, whether it is in language, in training, in flexibility, there's likely a door among these 9 provinces which will best fit you. So what does this mean for you? What it means for you is very simple. Variety is the spice of life. It means you don't have to force your career into one rigid pathway. If you are strong in family medicine, several provinces have seats which are reserved for you. If you are bilingual, Quebec is there and it opens a door for you. If you've experienced in some specialties, provinces like Manitoba and Nova Scotia are beginning to explore some specialist pathways. And if you are ready to serve in rural or coastline communities, many provinces will also welcome you with open arms. So this isn't about, competition between the provinces. No. It's rather about alignment. You aligning your preferences with the preferences of the province. So it's a match, right? You match up with the province and boom, you are gone. So that's why the 9 programs are not overwhelming, rather they are empowering. So if you are considering practice ready assessment in 2025, these are the steps I want you to take. Number 1, because there are 9 different provinces which provide these things. First, I want you to take a step back and do your research. Do a lot of research because the requirements differ from province to province, okay? And the reason why I want you to do your research is also because deadlines can close up to a year before the assessment begins. So for example, the PACE program opened, a lot of candidates applied, it's been closed for some time so they can deal with those who have applied and they can open up again. Secondly, I need you to use this website very, very well. It's called physiciansapply.ca, physiciansapply.ca. So just type that into your computer, physiciansapply.ca. The reason is because that is the centralized portal where everything is done through your medical license source verification, your transcript source verification. That is where you'll be taking your exam if an exam is required. That's where you apply. That is where you have your everything you need. So think about the Physicians Apply as your one-stop shop from which you can send various applications to various provinces. Number 3, I need you to stay clinically active. Stay clinically active, stay clinically relevant. The reason is because most provinces require recent hands-on practice. And in some provinces, if you've been out of active practice for 3 years or more, you'll be required to at times go back to the jurisdiction where you have your license, go through what we call currency of practice, where you may have to practice for a couple of months and then come back to that particular province. Okay? Number 4, prepare for the language requirements. Exams like IELTS, CELPIP for those who speak English, okay? And for those who speak French, TEF or TCF for Quebec. And the 5th point I want you to understand is understand the return of service. So know what 2 or 3 years in rural or coastal community means for your family and your career, okay? So think about all these things as we are going through them, because each of the steps we are discussing today makes you more competitive, more confident, and more ready when doors actually open. So Canada's practice ready assessment, they are not just about evaluation. No, it's rather about inclusion. How to get doctors with various backgrounds, various experiences to come into the Canadian healthcare system and help the healthcare system to grow. Okay. So the PRA is Canada's way of saying we understand your skills, we see your skills, we value the training you've had in your home country, and we want you to be part of our healthcare future. So just think about it again. 9 different provinces, 9 unique programs, 9 ways to turn that dream you've always had of practicing in Canada into reality. So no matter where you are starting from, I want you to know that there's a path for you. So if you found this video helpful and you want to stay updated on the practice ready assessment deadlines, the eligibility, the strategies for success, what I need you to do is just to do one thing. Subscribe to this channel, turn on the bell notification, join our growing community of international doctors and Canadian trained doctors, share the information with your friends as well. The reason is very simple, because your Canadian journey isn't about one door. Rather, it's about different doors opening and giving you different options so you can realize your dream. See you on the other side of success.